Hello, my lovelies. So I'm back, and it has been a crazy week. It's been so crazy. I'm drinking. I don't want to show the front because I don't want anybody claiming that I'm trying to use their product, but we need a stiff drink for this one. So, strawberry daiquiri. Num num num. Anyway, so how has my week been? You know what? 2020 is just shit. I mean, it's not the shit, it's just shit. It's like I saw this meme one time and it just captures it perfectly. 2020 is the year that we took the laxatives and the sleeping pills together and woke up to exactly what you thought you would wake up to, a complete shit show. Like if you agree, 2020 equals shit show. Yeah. And at this point, I don't even know what to say about 2021. I mean, it's just one of those things. Hold on a minute. My thermostat was acting up. Whew, there I am. Sorry, I disappeared there for a second. I know it got dark, but it's just because I have my living room light off. Anywho, as I was saying, the shit show. So, yeah. I'm gonna need a lot of these this holiday. Mama needs her happy juice. Stat. Oh, and my snack for tonight? Melatonin. Yeah. It's one of those nights. We have a strawberry daiquiri and melatonin gummies. Nighttime snack. Delicious. You should try it. I hope I pass out. Just like, oh, face first, I don't care, pass out, NyQuil, done. Anyway, I got strep again. You heard me right, strep. S-T-R-E-P, strep. First, my youngest got it. As usual, he brings it home to mommy like kids bring home art projects from school. No, my child brings home strep and art projects from school. But that's beyond the point. Art projects from school don't put me on an antibiotic. Strep will. So I went back to my doctor, who's probably sick as hell of seeing me. And he puts me on this extremely strong antibiotic because I've had strep so many times this year. It's like, I don't know. She my BFF. She like the choosing beggar that won't go away. There you have it. Strep is the choosing beggar that won't leave your home once the party's over. She's like, girl, can I have a ride? Do you have $10 for gas? Can I stay the few nights? Anyway, I'm getting off topic. I did get strep. I started a new antibiotic. Have never taken this before. Didn't even think about the fact that my youngest is allergic. But he is. He's taken this before, sadly, at a very young age. That tells you something about how many ear infections he had in his first year and a half of life. That's why we got the tubes. Anyway, I didn't think anything about it. So I took it because, I want to get well. And it was working on the strep. I'm much better. Good as good. Gold. So, good as good. So I was excited because it was only like 5 days worth of antibiotics. So I'm like, yes, I'm going to get over this. over, over, over. So day 1, great. Day 2, still feeling great, but having a little bit of lower back pain. But if you know me, I have some lower back injuries from a car accident back in 2011. So it happens. It's a hard knock life. So still didn't think anything about it. I decided I was going to kind of take it easy, take some Advil. I don't take very many medications. Even though I have lupus, I don't try to take medications. I just try to, either tough it out or take Advil, something light, OTC. I don't want to end up on a whole bunch of medications within my first year of lupus. That's just not, something I want to do. But it doesn't seem like I really have much of a choice because we're both constantly getting sick. Now, don't get me wrong. I'm receiving the shots to help combat the effects of lupus, and I've only had 2. And so far, I can say that they are excellent and they do help and they have given me a new lease on life. But I've only had 2. I'm not, completely protected. Without going into much of it, it's like a therapy, and it helps you build like an artificial resistance, an immune system, if you will. And when I first heard about it, of course, I was skeptical, and I was like, I was right there with all the skeptics, and I'm like, that's not going to work. But I had nothing to lose, so I tried it. And first shot was hell, I'm not even going to lie. I swelled up in all my joints, and I thought I was going to die, but by the time the second day, I felt like a brand new shiny penny. And it lasted until my next shot. And then I started feeling some of the effects, the swelling, the pain, and then the second shot was not as bad. It still wasn't great, but the swelling went down faster. Plus, I've learned some hacks on how to make the swelling go down faster. So that's always useful to know. Keep Epsom salt on you and be ready to take some hot water baths. It helps a lot. It really does. And hot water bottles and heating pads are great during that time when you're swelling in your joints and stuff. So, it also helps when you have a thyroid flare-up, like I do sometimes because I have hypothyroidism. So anyway, going on past that, I've been receiving my shots, but with Baby Lucid going to school, I was like, what is that? Oh, never mind. I know what that is. With Baby Lucid going to school and bringing home all the lovely germies, I have been getting sick. So I took the antibiotic. Day 1 was fine. Day 2, a little bit of back pain. Day 3 is where things get interesting. Now, if you're uncomfortable with talking about like body functions, I'm not going to go into full detail. Trust me, this isn't going to get gruesome. But I am a woman, and my body functions like a woman. So if that sort of talk kind of makes you uncomfortable, or if you feel that you're just not ready for that kind of talk in your life, move on. This is not the video for you. This is not something you want to hear and start dwelling on, obsessing on, because it may not happen to you. See, one of the things that affected my health too is that back in 2017, I had a tubal ligation. And for those of you who know, you know the health effects that it can have on a woman. For those of you who don't know, tubal ligation is the surgery you receive when you no longer want to have children, and it can shorten your urinary tract, a part of you that transports the urine to outside your body, and it shortens it, which was already short anyway, but it can cause bacteria to gather in that area, especially if you're prone to bacteria. Men have it easy. They have super long urinary tracts. They rarely get this because usually it flushes out. Now, I've known some men later in life start having this problem, but usually it's like once they hit elderly. And it's just super uncommon in men. But in women, oh my, we take the cake. My advice to you, if you're going to get a tubal ligation, is please be aware. This can happen to you. It can. Don't think it can't. If you're a woman and you're having a tubal ligation, this can happen to you. And for all my fellow women out there who have had a tubal ligation, girl, I feel you. I do. So I'll just get down to it, what it is. I got my third UTI. And I know some of you just went, ugh, no. Yeah. It's exactly what it is. And for those of you who don't know what it is, UTI stands for urinary tract infection. Basically, in layman's term, for lack of better words, it's a not kidney. I'm sorry, I was about to say kidney infection. No, it's not. That is a lie. I'm sorry. It is a bladder infection. It has nothing. I mean, it can get to your kidneys if left untreated, but it starts in your bladder. Actually, it starts in your urethra tube, which is why men don't usually have this problem, because they have an extremely long urethra tube, and women's are short, and then if you cut them off in a tubal ligation, they're even shorter. So, yay. Anyway, that's what happened to me. I didn't get my first UTI until after I gave birth, came home. Everything hurt. I had a cesarean. Everything hurt. Didn't realize that during my healing and rest and recuperation, I got a UTI until I was in sepsis. And I ended up in the hospital in shock. Septic shock. I couldn't drink water without getting sick. I was severely dehydrated. I had a busting headache. I didn't know where I was. I didn't know what was going on. Hell, I barely knew my own name. I couldn't sit still for 2 seconds. I was in so much pain. I was running high fever. I was just a hot mess. They had to hook me up to morphine to be able to examine me, because I was just balled up in a ball. And thankfully, I had excellent doctors, and immediately they were just like, you have a bladder infection. It's already up in your bladder. It's pretty bad, and you're going into septic shock. And they got the antibiotics straight into intravenous, straight in the good stuff, straight into the vein. And I was feeling better within like 2 or 3 days. It took a while, because I went home and I started orals. And then 2 or 3 days later, I finally got to where I wasn't being sick so much. The pain kind of subsided. And, if you've ever had a UTI, you know the pain and the pressure. When you have to go, you have to go. And if you cannot get to a restroom fast enough, you will pee yourself. I learned to take extra changes of clothes. Because not only did I just have a baby, which will weaken your bladder, but then I had a UTI on top of it. So, yeah. I'm not ashamed to say I wore Depends. Yep. So, I got another one. And I was racking my brain, because I'm like, I didn't do anything wrong. What did I do? I don't understand. I haven't had a baby. I haven't had surgery. I haven't sat in any perfumey bubble bath, because if you're a woman and you've had this issue, you know that sometimes sitting in your favorite bubble bath can give you a UTI. Lucky. I can do bath bombs though, just fine. I don't know what the difference is. I really don't. It has to be something they put in there, some sort of harsh chemical that's just not jiving with my body. So anyway, I tried to take over-the-counter medicines. I was still on my antibiotic, and I was like, just stick it out, stay to the antibiotic, and you'll be okay. Thursday, I was not okay. I took my youngest to therapy, and by the time he came out, it was only an hour. I thought I was going to die. So my husband rushes me to the ER, because we both thought I was going to die. Not really. I was just in a lot of pain. I thought I was going to throw up. And the doctors were great. The nurses were wonderful. Everybody was terrific. got me in as safely as possible with what's going on in the world. Of course, I wore a mask and I wore a face shield, and I didn't stand next to anybody. I just huddled in my own little corner, and my husband and child did not go in. I told him no, there's no reason to risk the exposure. I know how to isolate myself. I know how to keep people at bay real fast. So I got in there, talked to the nurse. She was behind a shield and she was wearing all her stuff. I got myself in a little corner away from everybody, which it wasn't full in there, but there were a few people. And I just kept my shirt up over my face, over my shield, and I just ignored everybody until I heard my name. Like, that's how I do things, even without a pandemic. I'm going to leave everybody alone. I don't want to be messed with. It's just the way I am. I get to my little corner, I leave you alone. If you come near me, I'm going to kick and scream. I'm just like, no. 6 feet back. Make it 10 feet and we'll call it even. And they called me back and everything was, I had my own room. Everything was isolated. Door shut. Nobody could get in. No risk of exposure. You know, I kept myself very covered still. And I was just like, so I was like overly protective. And everything was conducted in that room. They had a little restroom in there. So I didn't have to leave. They just said, step inside, pee in this cup. You don't even have to leave the room. Put it on this little tray next to the door. Knock on the door 2 times, and we'll know you're ready. Simple, simple. Everything went as planned. They came in. They had their shields and their masks and their goggles. And they were covered to the T. Talked to me. Got to, figuring out what was going on. And the doctor walked in. And he was like, well, he said, I think it's a UTI. He said, I'm going to treat you for a UTI. He said, but have you, and he asked me all the questions of things that start UTIs, and I was like, no, until he got to the very last one. He said, have you started any new medications? And I was like, yes, I have. I said, and I told him what it was. He's like, bingo, I know what caused your UTI. You're allergic to this medicine. And I'm like, my mouth didn't swell. I didn't break out in hives. I wasn't itching. I wasn't coughing. I wasn't wheezing. He's like, no, but this medicine is infamous for causing UTIs in women. He said, when you're allergic. He said, it is one of the biggest things about it. He said, I don't know. It's something about the composition. He said, but be warned, it does happen. News to me. So I got my shots, got my medicine, got sent on my way. My husband was already home, but I called him. He came straight up and picked me up and took me home. And so I wasn't out in the streets driving or anything because I was heavily medicated. They have this like little wellness room that they buzz you in and out of. So I asked them, could I stay in there? And they said, sure, because I had nothing contagious. So they buzzed me in. There was nobody in there. It was nice and toasty. My husband came. They buzzed me out. I went home. So, that was basically the gist of it. It's just that it has been a wild year. And I'm currently on 2 different antibiotics. One for the strep, which I'm not allergic to, and one for the UTI, which I am not allergic to. But it is just that kind of year. I don't know. All I could do is hope for better in the future, that, things are going to start looking up, and that as a country, we're going to pull together and support each other and help each other through this. Because if we don't, we're just going to rip this country to pieces, and that's not the kind of country I want my children to grow up in. And, that's just not where I want things to be. So comment below, did you understand any of these terms I said? If you're a woman up in your years as I am, you probably do. If you're not, you're probably terrified, and I'm sorry for that. That was not my intentions. But this is a mental wellness page, and if you don't take care of your health, then you're not taking care of your mental wellness. They kind of go hand in hand. And I didn't eat anything on this channel. It is late here, but who needs eats when you have drinks? That's going to be all this holiday. I swear to God, it's going to be. What's my theme for this holiday? Drinks and melatonin. It's going to be a holly jolly Christmas. And maybe a happy new year too. I don't know. We'll see. Maybe I'm losing my ever-loving mind. I don't know. So, okay, quick note. I know that my happy 30 subscriber video got put in the shitter thanks to something that I did wrong. Hashtag my luck. But I am actually going to redo the video this week. Comment below what you would like to see me eat, and it might just show up on my video. So I love you all. Stay safe. Don't get a UTI. And if you do, go to your doctor. That hurts. And I will see you in the next video. Bye.